Can someone please confirm? Are you able to hear me? Wonderful. Wonderful. Yeah. So in the last session, we started about with our special purpose domains. We started with demographics as the first domain, and we understand that the demographic domain is the one which purely talks about the subject, or I can say that it will give more details about the subject. And first, initially we started with what is the topic variable, because topic variable is the one which will give you the complete information about, or it is going to focus about the information that is provided by the domain, which is nothing but the subject ID. We have identifier variables which will identify what is this particular domain is all about. So we have three identifiers here. What are them? Study ID, that is study identifier, domain. Another one is unique subject identifier. In addition to that, we also have some other basic variables or basic columns that we are already aware of, which are nothing but the gender, age, DOB. These are nothing but these are the variables which we generally collect from your subject itself. We can also call it as record qualifiers, correct? Record qualifiers or collecting variables are the ones we can call it as gender, age, and DOB. And generally we try to understand what are the various dates which are part of this one. We can say that the moment the subject signed the informed consent form, we can call it as a ICF signed date. When the treatment starts, when the treatment ends, if something goes wrong, what is the death date? When the information is collected, that is demographic information collected date. So these are the various dates we basically aware of, correct? So now what we did is we try to write all the variables which are part of this particular domain. So those are study identifiers, domain, unique subject identifier, subject ID, which is investigator ID, investigator name. The second one is going to be a reference informed consent form, date and time in character format. Then we have few more dates here. We will discuss one after the other. Something related to arm, something related to the death and birth and site, hospital or the clinic. Basic demographic information, age in units, race, country, and ethnic. And when this particular details are collected. These are the various variables which are part of your domain. We haven't discussed all of them. We discussed one by one. We started with the initial ones and slowly focusing. So as part of it, first we try to discuss about the subject. The subject is nothing but the structure. The structure of your domain is only one record for each of the subject. Then under the identification variables, as we mentioned before, we started with study ID, domain, and unique subject ID. Out of all these three, your unique subject identifier is a derived variable, which is a combination of study identifier, site ID, and subject ID. I have given you one assignment here. I hope all of you might have done. I'm not sure of that. So far, I have received only one email, that too from the Mohanty, that too only for the first task. I have checked around 1 hour back. After maybe in the last 1 hour, if someone might have send it to me, I'm not sure, right? But as per my understanding, the last email that I have received from Mohanty, that too that I have received on some time back today. So I'm not sure of others. Have you done it or you haven't completed? I'm not sure, right? Guys, until and unless you work on them, you don't get a clarity. Why I'm telling this? These tasks together is nothing but our project, right? When you go with the project, so we are going to do 2 different projects. There, okay, Ankita, you don't have my email ID to whom you can send. Sure. Let me share a common email ID, right? So you all can you all can share your details there. All right. So just let me do that to all of you. You can send it here. Murali at, or maybe I can do TMK 12816 at gmail. Just a second. So everyone, you can send your email IDs or you can send your details to this particular one so that, yeah, we can go ahead with that. Okay, whatever, whoever is completed, please share it. Anyways, we are going to discuss these, whatever the task that I have given. I will explain all of them, but I would like to know, are you able to do this or not, or how you are progressing, what methods you are following, if anything, if any improvements are required, I can suggest. That is the reason I'm asking. All right. Investigator ID identifier, which is nothing but either a doctor ID, clinician ID, or nurse ID can be called it as your thing. Investigator name. So we started with the date. The very first date is going to be when you have signed the consent form or when the subject has signed the consent form. Remember, it is always RF stands for your reference, IC stands for your informed consent date, D stands for date, P stands for time, C stands for character format. Because the data type is character. We generally follow IS 8601. TA stands for only the date, DT stands for date and time. So here on these, I have given another assignment. I request you to complete it. Then RF SDTM, this is nothing but a subject reference start date. We say when the treatment actually started. So RF NTC is nothing but when the study is completed or when the treatment is ended. So there are two things. There are multiple treatments which are part of your study. When you have treatment ended, also you have your study ended. When both of them are available, you need to consider the treatment end date will be the date you need to consider for RF ENDTC. For few of the subjects, that is for unassigned subject, these values can be null. Who are these unassigned subjects? The people who are failed in the screening are maybe another group is the people who clear the screening but has not participated in any of the elements. Means they are not part of the evaluation. So those will be considered as unassigned subject. For unassigned subject, start date and end date, both of them will be null only. So I have given one more example here and I have asked all of you to work on this. So these are the various things we have discussed so far. Now the question is, any questions here? All of you are able to follow or any doubts? Can I have a quick confirmation from everyone? Understandable. Do you have any questions? If you have, what are those questions? Guys, if you are calm and if you are normal, I couldn't understand it. All right. So I will be in an assumption that all of you are clear afterwards. So with that assumption, I'm just proceeding with the next topic. The next, need to say the next parameter. The next parameter is going to be under the dates itself. So we were talking about the dates, right? Just a second. So we are talking about the dates. So the next date that I would like to talk here is, maybe I can pick it up from here itself. So we have completed informed consent date and we have completed your reference treatment start date, treatment end date. So now let's take this particular one. These three we can take. First thing. So RFX SDTM. What exactly it is? Right? This is nothing but, this particular one is nothing but date and time or date or time of first study treatment. So now there is a question. What is the difference? What do you mean by this? Because you have something else as well. Correct? So what exactly the meaning of this particular one? How do I know this is going to be how it is different from the previous STDTC. Because here also I said that it is a study treatment start date, normal treatment start date. But here I'm calling it as first, it is a date or time of first study treatment. What is the difference? Or if I want to even elaborate this, I can say that study treatment start date and time in character format. Now the question to all of you is, what exactly it is? Can someone please tell me, or someone, if you have an idea about it, can you elaborate on this? I'm asking about a reference study instead of treatment, study treatment start date. What exactly is study treatment start date? And how it is different from your regular treatment start date? Anyone? The patient come on time treatment. No, I couldn't get it. Patient come on time treatment. Anything else? Scheduled and actual date of treatment. Which is scheduled and which is actual? Are you saying that both of them are same, scheduled and RFX? Okay. So Sanch is saying that this is for the entire studies starting in this way also we can say. Okay. Can I call this as the start, whatever the study is there, entire study starting. Okay. So this is also another way of telling it. But what is the, how it is different from the other one? Any examples?
So Murli, the other one might be for that particular site. Uh,
Mhm.
so the site for that site, the first patient must have arrived. Sorry, the first patient treatment must have started. So that we can consider that date as RF-STDTC. And whereas for RF-XSTDTC, it might differ. In the sense, site B might have the first treatment done for the patient instead of site A. So the date might change in that case. Uh, is it?
Let me do that. Yeah,
Yeah,
true, true,
yeah,
true. See that whatever you said is possible when it is a multi-center, correct?
yeah, correct. Yeah, yeah.
Can you tell me if it is not a multi-center?
Then it would be same. The RF STDTC and RF STDTC would be having the same dates, because if it would be the first patient's first treatment, which would be same for the study level also and for the site also.
Okay.
Is it correct? Yeah.
One way it is, the other way
Mm-hmm.
there is a exclusion for that as well.
Okay.
So let me,
Okay. Yeah.
for an example, it is not a multi-center. It is, let's say that it is a only one site is there, within the same site the treatment is started. For an example, my study, okay, my study is about, let's say, study drug. The study drug is about, let's say, Covaxin. So why we are testing Covaxin, the overall Covaxin is going to be, I want to give it as a vaccination for the COVID patients, correct? Or maybe it is a vaccination. Let's not take vaccination. Maybe we can take another. Maybe, let's say a simple example, fever. So I'm just developing a drug for fever. That is the overall objective. My study drug is fever. So can I say that in this particular case, I want to give my stage or my treatment should start with by providing fever drug, a fever pill to the patient. Correct? That is what the actual drug is, right? I want to test this, so Already there are patients who are suffering from fever. So my trial or my study starts with giving a fever related pill to the given subject. But the same subject mentioned that he or she suffering with, or she having vomiting sensation, not even vomiting sensation. What will do? Now, the first thing that we are going to do is, first we provide treatment or drug to vomiting to control vomit. Only after that, right? Only after that we go with the study drug. Am I correct or not? Without providing the first treatment, without controlling the vomiting sensation, even if we give the study drug, if the subject vomited that particular one after having it, what is going to happen? Can I say that whether whatever the study that we would like to understand, the efficacy of the study drug that we would like to understand will not be efficient? We cannot have the proper measure of that particular one, correct? So what is the first treatment here? The first treatment we started is with the controlling this particular vomiting. Only after that we are going to provide the study drug. Am I correct? Let's say to control the vomit, right? You have given the drug on, let's say, today what's the date? 14th, correct? Let's say 10th April 2022, you've given this particular drug. And then the original study drug, the fever drug, that you have actually started on 11th April. So you have waited for 1 day. Once you got a confirmation that there is no vomiting sensation or there are no vomitings at all, only then you proceeded with the original study drug. Now you tell me which one is going to be your, can I say this is the support treatment, correct or not? The vomiting is going to be the support treatment. Whenever your study now started with a support treatment, not with a study treatment. Am I correct?
So study treatment word is important. Yeah.
Yes. Correct. So your study treatment is here, but your support treatment before you go with the study treatment started on the 10th day. So this one I can call it as RF XSTDTC, whereas this one I can call it as RF STDT. Am I correct? Now, is it clear between these two? All of you are able to understand? A very simple. Try to go on a lighter note. Yes or no? Everyone, any questions on this? For an example, let's say if the subject doesn't have any supporting treatment, doesn't go for any support treatment, in that case, can I say in that case, my RFXSDTC is equal to RFSDTC. Both of them. Everyone accept this? Can I have a confirmation on this? Right. Now, let's go for another example.
Murli, just
Yeah.
one question here. So, in this case, the supporting treatment is the concomitant medication, right?
Mm-hmm. Yes.
So in DM, we would be capturing the concomitant medication data also.
Yes. Yes.
Okay.
No. We don't consider the drug information and all that. That medication
Mhm.
details we don't have there. We only have this information.
Okay. Yeah.
Plus, if you look at the total number of variables which are part of your drug, which are part of your domain, the domain details will not talk about the remaining things. Only talk about what is going to be the arm code, actual arm code. So in this only these two I'm capturing. Arm and actual arm, these two only I'm capturing. I'm not capturing any other details, correct?
Yeah, but just the date we would be capturing, right?
Correct, correct. Date
Okay.
alone we will. That's
Okay.
what I'm
Yeah.
trying.
Hmm.
All right. Right.
Understood. Yeah.
Oh, perfect. Any questions from anyone else on this? Any follow-up questions on this? All right. Now let's go to the example two. Let's say it is going to be a multi-center study. So what is multi-center study? The study is happening at the multiple places in the same nation, correct? Or it can be also a multinational study. It can be also a multinational study, correct? What is multinational study? Across the globe it is happening. In this case, in these two cases, we can go with a different example. In these two cases, we can go with a different example. That is, a subject have completed, let's say subject had a treatment in site 1, right? And the same subject going with a different treatment in site 2, considering a washout period. So what do you mean by this? I have a washout period, that is during that particular period, the drug is completely gone away from the body, but the same subject participated in the two different sites. So initially he got drug A in site 1. After the washout period, again we are providing drug B to him in the another site. So when I look at, let's say the site 1 is going to be phase 1, the site 2 is going to be phase 2. So two different phases. Can I say that when I go with the phase 2 alone, when I go with the phase 2, when he is giving the, when he is actually taking the drug 2 at site 2 is going to be my RFSDTC, the treatment start date. But this guy, the same guy, during the phase 1 of the clinical study, he have actually taken the drug A. That happened at this site number 1. That will happen. That is going to be considered as my RFXSDTC. Am I correct? Are you able to understand this? That all of you guys can differentiate these two? Can I have a quick confirmation? All right. Perfect. Now let's go with the another next parameter. The name itself is telling you here. What is that? RFXENDTC. Simple. This is study treatment start date and time. I can simply call it as study treatment end date and time. Correct? It is always going to be study treatment end date and time in the calendar format. Questions? Any questions on this? So can I give one common example for both of this? Right? Consider both of them and we'll give an example. Example for dates. I simply call it as dates. For an example, there is a patient, nothing but there is a subject. So this subject, maybe I can take, yeah, this one. So we have a subject ID. Let's say subject ID is 111. Sex is nothing but M. Let's say this particular guy. So before he started with, let's say that this is the guy who got this particular vomiting sensation. So for him, the sensation started on somewhere on 10th April. Maybe I need to follow the clinical standards. So let's go with this. 2022 March 1st. So by this time, for him, the vomiting sensation started. So we have given the vomiting to control the vomiting sensation. We have given the treatment on May 1st. But the same guy, the original study treatment the original study treatment started on, that is on March 2nd, the original study treatment. Let's say that the treatment is about for the fever, so it started on this particular day. Right. Then, what is this end date then for the same people? So we have done all your follow-ups and everything, and finally on one day, that is 2022-03, let's say we consider 14 days period to go with the complete details. After 14 days, that is 16th. By 16th, we consider that that's the day we have given the final. That's the day we have given the final drug, or I can say that some final diagnosis we have done. That is the end of your treatment. Now, can I say that the same person, after this particular one, there is no other treatment. There is no other treatment pending. Can I call that this is going to be my same date as my study end date as well? Can I say this is the correct one? That is, we started the support treatment on March 1st. We have given the original study treatment on March 2nd. We waited for 14 days to see all the side effects and see whether all the things are controlled or not. On 16th, we confirmed that everything is okay. We just have given the final drug on that particular day. That is going to be the end of the treatment also. We said that there is no follow-up required after this particular one. Now, what is going to happen? Can I say that this is going to be my final treatment as well? This is going to be the end of the study treatment. This is also going to be the end of your treatment, final treatment as well. Correct or not? Right? Now, okay, all of you are clear with this example? Is it giving you the right answer? Any questions on this? All right. Let me go with the next one.
Murli, just one question here. So, in case
Yeah.
if we have that patient dropout, subject dropout, so in that case, the RF ENDTC for this subject would be blank, right? And RF ENDTC might be uh, for that site which closes last.
No. Let's say that. Okay, give me a second.
Yeah.
Raja, I think I'm clear enough. Guys, is my voice, all of you, is it comfortable still? Or are you feeling that my voice is low? Okay, if any of you feeling that my voice is okay. Now, Mohanty, you need a different example. I'll give you that as well. I'll give you that as well. All right. For an example, this is one for fever. Let's say there is another subject. There is another subject, 222. For this guy, maybe I can go with a different example. There is another subject 222. Let's say this, but for this particular person, let's say female. For this particular lady, we are going with the orthonet treatment. Mean to say that she is having some problem with the knees. That is, let's say that the knee problem is there. So the doctor diagnosed with that particular one and understand that. So we wanna start with, let's say that initially the doctor mentioned that let's go with some of the tablets which will improve your whatever with the gel in your kneecap. So with the increase in the gel, the friction at your bones will be less. Because of that, you don't feel much of the pain. That is the initial understanding and the initial diagnosis is provided by the doctor. So let's say on the same March 1st, the doctor actually given the, so I'm just talking about the orthonet. So problem is burning knee. So the first on the RFXT-DTC here, that is nothing but on 2022-0301, the doctor mentioned that why can't we go with injecting gel into the kneecap. So this gel is going to help you to go with the to reduce the friction, which will give you some relief. So the patient has waited for, let's say, 10 days or 1 week. On 10th, the patient revisited the doctor and mentioned that, hey, whatever it happened, it has reduced a bit, or it has given me bit of the relaxation, but still the problem exists. I'm still feeling the pain in the knee. So then the doctor decided that it won't happen. So why can't we go with the other option is, let's say we will go with the knee replacement. That's the only alternative because it is not going to happen. So knee replacement. So when the knee replacement happened, the knee replacement happened on the 10th. So doctor mentioned that after the knee replacement, there won't be any major things that you need to take care, but all you need to do is, let's say, before I discharge you, let's say that after a week we are discharging you. So at the time of discharge, so for the knee replacement, right, the time of discharge, I can say that whatever we are going to do, some basic medicines, antibiotics, or other some healing things we are going to do. Healing medicines. I'm giving you on a hypothetical notice, guys. It may not be a relevant example, but I'm trying to give you my best. All right. Now, after that, doctor mentioned that you need to have a follow-up, right? I need to check your knee, right? I need to check your knee, and I need to ensure that everything is proper. So he requested the patient to come after 15 days, that is after 10 days. So here, sorry, 14 days. So here what he's trying to do is he checked the knee again, and he understands that healing is good, but there are other side effects. Let's say that some issues the patient is having. For that, he has given some supporting medicine. So now the treatment, the original treatment starts here, right? The study treatment started here, and the study's treatment ended at the 16th itself. But the original, the complete treatment is actually ended on 30th of the March. Mohanty, is this understandable? There are cases where we are going to have the different dates as well, right? May not be the right example for this particular one, but I'm trying to help you with the more or less relatable things. Any questions on that?
Murali, you see the end, RFX and DTC, the variable is different.
What do you mean by that?
Okay, you read out the variable subject, sex. No, you're same data. Sex, RFX SDTC, RFSDTC, and then RFX. It should be E and.
Okay, got it. I got it. This is
So my question was RFX NDTC and RF and DTC, when they will be different. You got it?
This is
maybe
every time it,
yeah. So that's okay. Yeah, I got it.
Perfect. Any questions from anyone else? All right.
So Murli, in this case, if we take the example 2, in this case, if the subject doesn't come on if we
After the
say,
follow-up, let's say 16.
before,
After the subject haven't come, right? He haven't visited.
Yeah.
That is going to be your pending.
Acha.
That is
Okay.
participation, end participation date.
Okay, so for that particular subject, the data entry would not be there for these variables, right? The date would be populated for RFP, ENDTC, correct?
Exactly. The
Okay,
ENDTC null.
would be blank, huh? Yeah, understood. Yeah, thank
Now
you.
let me, perfect. Let me explain this. So we are talking about this. This is nothing but reference and participation date and time in Canada. There are multiple scenarios for this. There are multiple scenarios for this particular one. So what are they? Number one, what are these exactly? It can be a study completion date, correct? If everything goes well, the end participation date is nothing but the study completion date, correct? That is the time last, for the last time the subject is participated in the study. If not, it is going to be my final follow-up date. After follow-up, he or she haven't come. Or it can be a death date. So there are, let's say that there are two more phases in that particular treatment. Let's say once we started the study treatment, before he go with the original treatment itself, the original treatment itself, the patient is no more. So that is going to become my end participation date. Or it can be the discontinued date. So this is what you asked me, Sanchi.
Yes, yes.
Discontinued date. Correct?
Yeah,
In all
yeah.
these cases, I can say that this is going to be my discontinued date. So let's say that in the example that I have just talked about now, let's say they take the first one. So in this example, what is going to happen? Subject is there, start date, end date, both of them. Let's say we started with the vomiting sensation, the treatment we provided, original treatment has started, then it is going to be treatment end date, subject treatment end date. Let's say everything is done. This is the last time. After that, the subject need not to visit the hospital anymore. Can I say that in this particular case, this is going to be my participation end date as well? Correct? My participation end date, my reference, that is my treatment end date, as well as my study treatment end date. All these three are going to be the same. Possible? Take this particular example now. So in this case, the study treatments supporting treatment start here, the original treatment started here, it ended here. After the follow-up, the patient is not visited. Null. Correct? So there is no reference NDTC. So what is going to happen? Let's say this is going to be the time where we want to do the follow-up. Correct? For the follow-up, the patient haven't visited. Right? The follow-up is actually on the last thing happened on the 16th. After 16th, this patient hasn't visited. So can I say that this is going to be the day where the patient last participated in the study? So can I say that this is going to be my participation end date as well? Right? When was the last time the patient or the subject has done this particular study? Right? That is equivalent to my patient participation end date as well. All of you are clear up to this, the dates part? Right? So all these are scenario based. We go as per the scenarios. Questions?
Murli, in this case, if the patient has not come after the RF STDTC, then in this case, RF X ENDTC, everything will be blank, right? And we would populate P.
Yes. STDTC will be blank, XENDTC will be blank, and RF and DTC is also blank. But the last time he participated was on the STDTC. So it is going to be my STDTC is equivalent to your participation end date as well.
Yeah, yeah. Okay, yes. Thank you.
All right. Let's see where we are now. So let me talk about this, and then we'll go with the ARM code. Okay, so let's say we are talking about death date. Right. The first one, the name itself is telling it is going to be death date and time in character format, correct? If any subject, this is going to be subject, death, date and time in character format, correct? That can be on any day, that can happen in any phase of the study, correct? Now, where it will be, meaning we need to have little understanding about some note I need to tell you here. Let's say we are part of this disposition domain. Let's say domain is equal to disposition, correct? In the disposition domain, right? If we have, for disposition domain, we have DS term, right? What is the DS term? Nothing but here, the focus, which is nothing but the topic variable, right? So if we are going to have your DS term is equal to death, if it is equal to death, in that particular case, my DSSDTTC, that is nothing but your start date and time, your death start date and time in character format. This will be considered as your death date if you are talking about the DS domain. Suppose if you are talking about your adverse events, because the event, the death is also an event, right? So in this particular case, if AE out, there is a variable called AE out, and if that AE out variable is equal to death, in that particular case, adverse event end timestamp end DTC, this is supposed to be considered as your death. These two you need to remember. These two you need to remember. What are them? As long as the name itself is telling you death, date, and time in character format, the node you need to understand is if it is a disposition domain, we'll talk about that again anyway. If the DS term is equal to death, then DS SDTC is going to be a death date. If the domain information that we have provided is of the adverse events domain, then if AE out is equal to death, then only in that particular case, AENTC, that is going to be your death date variable. You need to remember these two, and these are going to have a lot of impact while if something happened to the subject. So you need to remember this particular one. All right. So then DTHFL, which is nothing but death flag. Simple, death flag. The death flag can be, it can have only two values. The two values can be either yes or no, right? So what is the meaning of it? How can I go with this? If the patient is no more, if the patient has the death value, sorry, death date, I can say that it is going to be a death flag equal to yes. If not, death flag is equal to no. Okay. So let's have a simple task on this particular one, and then we can proceed with the next example. Let's say your assignment number 4. So the kind of assignment that we would like to go here is a very simple one. A very simple one. All I'm going to have is going to be, I just have patient details as well as your name, because I told you there are two domains information, correct? The domain information that I have given here is going to be two domains. I told you one is going to be DS domain, another one is going to be demographic domain. Let's say from demographics, your input data, the input data, that too I'm getting from the demographics domain. So from DM domain, I'm getting it. So from DM domain, what and all I have, I'm going to have the patient information and the gender information. Let's say take this. So I have these two. All right. And then I have one more domain, which is nothing but my disposition domain. Let's say DS. So from this particular one, I have three information again. So I have, let's say patient ID is there. Here instead of the gender, I have term because it's all about the term there. And again, I have the third one, which is nothing but STD. Okay, three information is there. So under this particular one for the same patient, let's say it is going to be death. And the date here is going to be 2022-03-11. For the other one, the study completed. Just no, nothing happened, the study got completed. Again, for the next patient also study completed. Then the other patient, it is death. And for final patient, it is study. So I need to have the different dates. The different dates are going to be like this. Let's say study completed on today. Let's say that 14th April. The same study completed today. Study completed today. But this guy, something went wrong after some phase, let's say 31st, he's doing. Now what happened? I have, what are the details that I have here? I have patient details. At the same time, I have their term details, different term details. Correct? Now, all I need is my desired output is here. So my desired output is going to be, I just need information about subject ID. I need information about the sex, and I also need the information about the other things, which is nothing but death date, DTH, DTC, and also we need death flag, DTH. Yes. Can you tell me what are the details I'm going to get here? 111. So for this particular guy, it is M. Then the death date and time is going to be this. It is in the same format. And finally, I'm going to have the death flag. What is going to be the death flag? Yes. 222. Study completed. I don't have any death date. So what is going to be the flag for me? Either I can have
N.
Y or I can have it as N. Correct? So there is no death flag for this particular guy, N. Then 333. 333, it is going to be female. Study completed. No death happened. 444. Yes. Death happened on this day. Yes. 555. Female. No death date. The death flag is going to be yes or no. Or if you don't want, you can also remove this. Just make sure that the expected output is going to be. If it is yes, just keep it yes. Otherwise, just leave it. All of you are clear?
Yes. Yes, ma'am.
All right. Maybe here itself, let me complete. Okay, maybe I'll go with this. Guys, please complete your assignments. Don't neglect that particular one. That's my request. Okay. All right. Then just birth date and time, nothing but date of birth, subject date of birth, subject date of birth in character form. I don't need to explain anything here, correct? So I'm not going in detail. So the next thing is going to be, we are going to talk about age and age U. So age. So The name itself, it is pretty much straightforward. That is subject age. And remember, there is going to be a age calculation as well, right? We'll talk about this later, but I'm going to give you the calculation alone. So subject is generally calculated as, mean, how much time you have spent in the study. That is the meaning. How much time you have spent in the study. That also will be considered, because okay, let me tell you how it will be calculated. For an example, this study is of have a span of 2 years. Let's say somewhere we started in the 2020 and we expected to complete this particular study by 2022 June. That is 2 more months is there. Now, by the time the subject entered into the study, the subject age was 20 years. Now it must be 22, correct? The subject age is always, as the number of days progressing, the age also will increase. Now, can I consider my subject age as 20 or 22? By the time he entered into the study, it is 20. Now it is 22. The study is still happening. So what is the age of this particular subject?
22.
22. Any other? Anyone? 22. Mahipal also saying 22. Guys, give a shot. Nothing wrong, even if you say wrong or wrong answer, right? So don't hesitate. Please tell me. Okay. See, as the span increasing, the age also will change. So always when someone asks you, hey, at what time the study started, that is going to be my age. So generally, if I want to calculate the age of the person, generally how we are going to calculate, let's say age is equal to today minus my date of birth divided by number of years, 365 days. Am I correct? Of course, leap years and all that, but in general, it is going to be 365 years. Is this how you are going to calculate your age? All of us. Now, since the today is always changing, right? For tomorrow, if I do the calculation today and if I do the calculation after 1 month or 2 months, all the time, this factor will be keep on changing. So generally, what we do is the time when the consent was signed, the consent form was signed. That is RF ICSD. That is the time when the reference informed consent form signed by your subject, that is going to be my day minus the date of birth. Just now you calculated the variable representing that is going to be date of birth divided by, instead of going with 365, we will go with 365.25 by considering the leap years and everything. This is going to be your age calculation. All of you remember this? Age calculation is simple and straightforward. It's supposed to be your, whatever the day you want to calculate the age, the day minus your date of birth divided by 365. But as the span increasing, there is always your age will be changing. To make it as a constant, the time you sign your informed consent form, that is going to be your day for your age calculation. To avoid all your leap years and everything, we generally consider it to be 365.25. Any questions on this? Any questions? All right. This is self-explanatory. What is that? Age in units. The unit, yeah.
Murli, just one question here. So, when we analyze the study at the end, that time the age will differ.
Correct. But
Okay.
when the treatment has started, the initial
Sorry.
treatment, when the
Mm-hmm.
initial treatment is started, let's say I want to have a study on the people, right? Let's say, for an example, maybe not the right, but maybe I can go with this. Let's say there is a analysis happening on AIDS, HIV. So we have considered a volunteer who entered into this particular study somewhere in 2014. So still the study is happening because we don't have a drug for HIV yet, correct? So from how many years he is participated in, have been participating in this study? Can I say for past 8 years? By the time he entered, right, his age was 30. Now he is into 40, the 38. So can I consider his age as 38 or can I consider his age as 30? Because we have started providing the drug to him at the age of 30. That is when it started, correct? Suppose if I try to give the same drug to the patient who is of 38 years of age, by considering the current day is 38, considering that if I give it, the drug may not be efficient because I have been giving this particular drug to this particular patient from past 8 years. So over the 8 years period, it is giving me the result. Suppose if I want to give the same drug to the person who is into the early 40s, the drug composition should be different. The dosage should be different. I cannot give the same dosage. If I give the same dosage, the efficiency will not be the same. Am I correct?
Correct.
So
Correct,
always
Murli.
consider. Yeah,
But then, when we are starting the study, we have the inclusion and exclusion criteria. So,
correct.
in inclusion criteria, if we consider the same example that the subject is 30 years old, and that's why we have enrolled that subject in the trial. So, as the trial progresses, he is reaching 40. Uh, so in that case, wouldn't the analysis or the final report be incorrect in the sense the include it won't be passing the inclusion criteria, right? Or there must be other parameters which we would be taking into consideration during that analysis.
There are a lot of parameters you are going to consider because
Mm-hmm.
if it's a treatment drug, if it is a treatment drug, the example that I have given will not be the correct one, correct?
Mm-hmm. Yeah.
Because how many diseases you have with such long impact or with such long span? Can I say very less?
Oncology. Yeah. Yeah.
Very less, to be honest, correct? So for those, we always have this inclusion and exclusion criteria. If the majority of the people are falling under this, all right, majority of the people are falling under that, we still consider it as a correct one. Let's say only 5 or 6 people who are taking this particular drug for all these years, there is no death happen and there is no improvement in their health condition also, both of them are there. Can I consider them as outliers and I can remove from my study itself? I don't consider them as part of my study anymore. I'll consider them as outliers because there is no improvement in the health, or death happened, or in the worst case, there's nothing happened to him. So my drug is not efficient. Even the death happened, the drug is not efficient. There is no improvement in the health, there is no efficiency. In both the cases, my drug is not working on this particular fellow, even though he is there in the study for 8 years. So let's exclude him. Don't consider him. Consider him as an outlier, right? It is not one example. With that one example we cannot conclude, but all I'm trying to say here is going to be, it is a standard. The standard is going to be, when you want to consider the age of the person, the moment the subject signed your informed consent form, at that particular day, whatever is the age of the person, that is going to be the final age. We don't consider the span. Clear?
Yes, Madhu.
Yeah. There is another reason for it. There is another reason for why we want to do that. 90% of the cases, except the ones where we don't have any medicine, clinical trials won't last for more than a year. Am I correct? Until unless it is critical. Most of the clinical trials will be, the span will be not go more than a year. So when it is not happening more than a year, even if you consider your informed consent date, or even if you confirm even if you consider the date on time by the time you are collecting all your what to say, your measurements and all, like your final study and all, it won't make an impact. It won't make much difference. But for the standardization, we consider informed consent date. Okay, there is another reason for it. Questions? All right, next thing. So here we are again, then we consider the simple parameters. The simple parameter is going to be country. There is nothing we are going to talk about this particular one, but only thing that we are going to talk here is going to be the country code. Country we always represent with country code. That is represents with country code. Okay, then what? So you're representing with country code, but what it is? It should be 3 characters long. Meaning, example, if you are representing India, IND. If you are representing USA, it is going to be USA, United States of America. Always 3 characters. Right? There is nothing much to explain. I'm simply going with the other one. Race. Simply speaking, color. Simply speaking, color. Or you can also say that continental information as well. Which continent he or she belongs to. That is also will be considered as your race. For an example, in general, black, white, Asian, all of us, correct? Then most of us, sorry, all of us, not all of us, most of us. Sometimes it can be other as well. What do you mean by other? Who and all falls under other. So this example for others is going to be sometimes the person is not a black or white or is not belongs to the Asian continent, but other continents are there. European continent, but in that again we want to go with some. For an example, Italian. That don't consider it as a language, right? Brazilian, Canadian, like this. You can also represent the race as based on the country information. The another thing you need to understand here is going to be sometimes whatever important note that I'm mentioning here, guys, the meaning is there is a high possibility that you can expect this as part of your interview, right? So if anything other related race, we will pass those values to the supplement domain, right? If race is other, if race is other, we will be passing this information to the supplement domain as well. So what is the meaning of this? The meaning is very simple. That is, suppose maybe we can simply put like this. Under the others, right, if the race is other, we can simply call it as, this will be, this information we also can pass like this, SUPPDM. That is, get this information from the supplementary domain. All right. For an example, in the demographic, if it is going to be, again, if it is going to be a demographic domain, then we pass this as SUPPDM. If it is going to be adverse events, if it is going to be adverse events, in that particular case, you will call it as SUPPAE. That is, instead of others, we can pass this information as a supplement domain. Clear? So you can understand this particular one once we go to the respective domain. Under the supplementary domain, again, I'm going to explain this particular information. All right. So we talked about country and race. Let me put this at the top so it will be easy. Age is over. Okay, let me take all this together. Age units, race, country. Now you need to go with ethnic. All right. So what is ethnic? Anyone? What do you represent under ethnic? Can I say it's simply going to be my ethnicity of respective country. Whatever the country that we are talking about, the country's ethnicity we are going to talk about. For an example, a person, maybe I can give you a few examples here. Let's say if the person is coming from Latin America, can I say simply it is going to be called it as a Latin American? Can I do like that? So based on the country information, every country is going to have that particular one. For an example, simple. Yeah, thanks, Anji. We are in India. We all belongs to India, so we can simply call it as our ethnicity is going to be as simple as that. All right. So all the people who are coming from United States of America, Americans, right? A very simple and straightforward. Right. Now we will enter into the most important thing, which is nothing but when we go with the collection. Maybe I can do this by tomorrow because there is too much of theory happening. So I don't want to go with that particular one. So let me stop here. But before I stop, let me help you with what we are going to discuss tomorrow. So DMDTC, which is going to be a date and time of collection. That is the first thing that we are going to discuss. Then we are going to discuss about DMDY, study day of collection, right? So it is going to be a derived variable. Let's discuss about this in detail by tomorrow. All right. And what else is pending? There are a few formulas will be there that we need to discuss as well. Then ARM is pending. So maybe once we complete it, there are a lot of tasks here. So then we go with ARM. Yes, perfect. So we talk about ARM, that is description of your planned ARM. We are going to talk about ARM code, actual ARM code. Correct? Anything other than this? I think if you complete these 6, 1, 2, and these 4, 6, then I can say that we are good with the demo. 99.99% tomorrow I'll complete this, so that we will be having ample amount of the time for the next one. So once demographic domain is done, then we can go with the subject visits, then subject elements. So those are all very quick. We can simply quickly we can run. Demographics is the most important one. That's the reason we are spending our time here. So DMDTC, DMDY, there are a lot of calculations involved there. So we are going to do all those calculations. Then we go with the ARM code, actual ARM code. With that, we can say that we are good with the demographic domain. So whatever the notes, I think today's notes also important because you have one more task to do. So I will send this particular notes right today itself. Okay. Or I'll do one thing. This is the only thing that I'm expecting here, right? So assignment 4 I'm keeping here itself. All right. So you can do it. Otherwise, I'll send it. Why unnecessary confusion? I'll send it. I'll send the notes. Complete the assignment 4 as well. So by tomorrow, at least can I expect everyone complete all the 4 assignments? 1, 2, 3, 4. Yes or no, guys? Can I have a confirmation from everyone? All right. Perfect. Okay. Tomorrow we'll meet and we'll complete the demographic. Okay. Take care of you guys. Take care everyone. See you tomorrow. Bye. Tomorrow class is there. Tomorrow class is there, and I'll take the class tomorrow. Okay, take care. Bye.